Hello, and welcome to the Dementia Capable webinar series provided by the Rosalind Carter Institute for Caregiving in partnership with the Georgia Division on Aging Services. Before getting started, we advise having a pen and paper ready to write down any information and links to the resources as they are provided. Otherwise, you will have to view the webinar again to retrieve it later. You may pause the webinar now if needed. Remember that the link to the SurveyMonkey post-test will be pasted onto the last slide. The post-test will remain open for an indefinite amount of time. Please take it at your earliest convenience, though we encourage immediately following the webinar. A certificate can be provided when entering your email address at the end of the post-test. Today's webinar will be Recognizing Risk Factors ATS Staff, presented by Susan Peterson-Hazan. Susan Peterson-Hazan graduated from the University of Georgia with a master's in social work. She is a licensed clinical social worker working at Emory University School of Medicine in the Department of Neurology and with the Emory University Alzheimer's Disease Research Center. Susan works in the cognitive neurology and does family meetings and psychotherapy with individuals with memory loss and their families, with a focus on mild cognitive impairment and early-stage Alzheimer's disease. Susan has also developed a number of disease stage classes for people with memory loss and their families. Welcome, Susan.
Hello, and thank you for joining this webinar. The objectives today are to understand the difference between normal age-related memory loss and mild cognitive impairment, to learn about the risk factors for developing Alzheimer's and other dementias, to learn about when to seek an evaluation or when to encourage a person you may be working with to get an evaluation of memory, to review proactive strategies for maintaining brain health that you can educate people about, and to learn about healthy brain research opportunities. As we age, it takes longer to learn new things. However, we can, as we age, continue to master new technology and learn new things. It may take us slightly more time to recall names, and some mention that words don't come as fluidly as when they were younger. And everyone talks about occasionally misplacing their keys. However, I seldom meet someone over 50 who doesn't say that their memory is not as good as it was when they were younger. They may forget the name of a restaurant. However, they can tell me in detail about how to get to the restaurant, what they had to eat, and many other details of that social engagement, how many people were there, and what they did before and after the event. So they aren't having serious memory problems, but they did forget the name of that restaurant. Another thing that happens with normal age-related memory problems is that multitasking speed declines. It becomes more difficult to be attentive to more than one task at a time. Thinking speed may also decline. It takes longer to remember the name of that acquaintance at church. Although the people you know well at church, you have no problem coming up with those names fairly quickly. And of course, families and friends are easily remembered. So normal age-related memory loss and a more serious memory problem is subtle. The differences are subtle. I worked within a cognitive neurology clinic, And a common problem that we hear reported by people is, I just don't think my memory is as good as it always was. That's the same thing people that have normal age-related memory problems report. So it may be serious or it may not be serious. Oftentimes people report that they have to listen a lot more attentively when they are trying to remember things. They have to be more deliberate and listening to the answers to questions. Some people report having less confidence when driving to new places. They are confident locally, but less so if they have to go to places further from their home. And some individuals report difficulty following directions. They may have to be more diligent about writing down their appointments and commitments with friends and family. Oftentimes, memory problems, particularly in the very early stages, are noticed by the individual themselves. And they are the ones that take action and want to have an evaluation because they are concerned. Other times, people may not recognize their memory problem, and it is a family member who recognizes that there have been subtle changes. So people come for a memory evaluation when they are worried about their memory. They bring themselves in many times, and some of them bring themselves in because they have a family history of Alzheimer's disease or some other form of dementia, and they want to be checked out early on. They hope they can have their memory cleared. We used to think about these individuals as the worried well. However, research has found that some of these individuals will go on to develop Alzheimer's disease, and therefore it's important to find the cause of their problem early on. And so they seek an evaluation. They seek an evaluation through a neurologist or a psychiatrist or a geriatrician. They may even go to their primary care doctor to see if they have medical problems that could be causing this subtle memory problem, and perhaps it's reversible. So mild cognitive impairment is a risk factor for Alzheimer's disease. But it's important to know that not everyone with mild cognitive impairment does go on to develop Alzheimer's disease. And this is a very important and active area of research. This is probably a good time to mention that over the last 30 to 40 years, we have learned a lot more about Alzheimer's disease. And if you think back 40 years ago, most people that came into a neurology clinic with memory problems were brought in by their families, and they were probably already well into the middle stage of Alzheimer's disease. About 20 years ago, 20 to 30 years ago, it became easy to identify early stage Alzheimer's disease, people who were having memory problems, and it was beginning to impact their day-to-day functioning. And in the last 15 to 20 years, we have been able to identify this more subtle memory problem that we now call mild cognitive impairment. And this is all very important to hopefully advancing research so we can find a way to impact the course of Alzheimer's disease. This video on mild cognitive impairment is a very good video if you have the opportunity to look at it. You can write down the link that I've put in here, or you can go to YouTube and Google mild cognitive impairment and Janet Cellar, and I think the video would pop right up. she talks about how the mild cognitive impairment, not everybody gets mild cognitive impairment goes on to develop Alzheimer's disease, but some do. So what are the actual characteristics of people with mild cognitive impairment? First of all, it's characterized by mild short-term memory problems. In other words, things that have happened recently. I oftentimes have families that will say, oh, mother doesn't have a memory problem. She can remember details from her past. Well, that's not exactly what we're looking for. Mild cognitive impairment is losing things that we have heard in the last maybe day or week or even in the last few minutes. Those are the significant areas that point to somebody having a memory problem. However, with mild cognitive impairment, people are functioning independently in all other areas of their life. Some people come in, they're still working, but they're concerned about their memory, and they want to have it checked out because they feel like they're not working as efficiently as they once were. One of the areas that we look at is this mild memory problem caused by stress or depression. And if there is a sign that these might be affecting a person, we encourage them to get treated for their depression. And some people that come in, we know that some of it may be a transition state between normal aging and dementia, a more serious problem like Alzheimer's disease. One of the things I will say here is that when people come in for an evaluation of mild memory problems, they oftentimes find a relief when they get a name put on their problem. They may find that they are functioning normally, and they do not have even mild cognitive impairment. Or they may have this name, mild cognitive impairment, put on it. Many couples that we work with have reported that when one of them is diagnosed with mild cognitive impairment, it was an incredible relief because they actually thought there were problems with their marriage. And finding out that there is a reason for these memory losses actually was helpful to them, and it was reassuring that there was a medical reason for the changes that they were experiencing as a couple. Some people do express the concern, but maybe about developing Alzheimer's disease. But what I always say is that once we put this label on you, it doesn't change anything. It just means that we've identified that there is a memory problem. It may get worse or it may not. This is one of the few books that are written on living with mild cognitive impairment. And it is a book that I do suggest for individuals with mild cognitive impairment and for their spouses and families. And I think it's also really valuable to professionals who are working in the field of aging because it is a comprehensive overview on mild cognitive impairment. We're going to come back to how we evaluate memory problems in a few minutes, but I want to, at this point, talk about risk factors. So we now know that there are stages of memory loss. There is normal age-related memory loss that does not get worse over time. There is mild cognitive impairment that is subtle, but that does get worse over time, and people can generally identify that their memory is getting worse. There is mild Alzheimer's disease, or another form of dementia. There's moderate stage Alzheimer's disease, late stage Alzheimer's disease, and terminal Alzheimer's disease. So the biggest risk factor for memory problems, and Alzheimer's in particular, is age. And this particular chart is put out by the Alzheimer's Association in their annual report, which you can get online at their website. And as you can see, when you are under the age of 65, you only have a 4% chance of having Alzheimer's disease. But that risk increases to 16% for people between the ages of 65 to 74. And the biggest risk areas for people between the ages of 75 and 84, 45%. And finally, if you are 85 years old and above, the risk goes down to about 38%. So we know that aging is the biggest risk factor for Alzheimer's disease. Another significant risk factor is family history. Having a parent, a brother, or a sister who developed Alzheimer's increases risk. It doesn't mean that you will get it, but it does increase risk. And finally, there is heredity, the genetics of our bodies that we inherit from our parents. There is a risk gene called ApoE4 that increases the likelihood of developing a disease. But it doesn't mean that you absolutely will develop the disease. It just means that there's slightly increased risk. There's another set of genes called deterministic genes. And these are families that have a autosomal dominant Alzheimer's disease gene. This is rare. Less than 1% of people with Alzheimer's disease fall into this category. And we have found in our clinic that oftentimes people who have this gene in their family, because there have been so many people that have developed the disease, are very likely to suspect or know that they have this genetic risk. I should say that not everybody who has a parent that has this gene, the deterministic gene, will necessarily develop Alzheimer's. It depends on if they have been the one to inherit that gene, and not everybody will inherit it. So those are the risk factors that we cannot modify. We cannot change the family we're born into. We cannot change the age that we are. However, there are risk factors that we may be able to modify. One is to protect ourselves from head injury. If you're riding a bicycle, wear a helmet. And we know that there has been a lot in the news about football players who develop dementia, or at more risk of developing dementia. And they're learning more that it could be to the head injuries that they develop, although there's still a lot that we don't know about that. So protect yourself from head injuries. The next thing that we can do something about is remembering that what's good for our heart is good for our brain. Our heart pumps blood through our blood vessels, and so we want to do everything we can to protect it. We want to manage our diabetes. We want to manage our high blood pressure. We want to watch our cholesterol, and we want to decrease our stroke risk. So how do we do that? How do we decrease our risk? There is research on modifying our risk of developing mild cognitive impairment and progressing on to Alzheimer's disease. And one thing that has come up over and over again is a Mediterranean diet. And this is more than a diet. It's really about cooking and eating simple, delicious, and fresh fruit. It means having a high consumption of fresh fruits and vegetables, eating more beans and moderate amounts of fish, and having a low to moderate amount of dairy in your diet and limited red meat, but encouraging you to eat tree nuts and to use olive oil, and if you drink red wine, but only in moderation. There's been many studies on diet, and I'll just highlight one of them from the Archives of Neurology that was done by Columbia University that examined the relationship between diet and the development of Alzheimer's disease in 2,000 dementia-free adults over the age of 65. And what they found is that persons who consumed a Mediterranean-type diet regularly were 38% less likely to develop Alzheimer's disease over a 4-year period. Now, this does not guarantee, a Mediterranean diet would not guarantee that somebody does not, but it would give you a leg up on prevention. A second area that helps our brain and health overall is exercise. There are numerous studies out there that talk about the positive value of exercise. This particular study reviewed many studies and the effects on physical activity on cognitive functioning. And they looked at those studies that enrolled people that were over 60 that had normal memory, normal cognition, or mild cognitive impairment, or they had neurodegenerative diseases like Alzheimer's disease. And the interventions were either no physical activity or stretching, or they were put into a physical activity that was aerobic or isometric. And the outcome was that physical activity is beneficial to aging individuals. This National Institute on Aging website, Go for Life, is a wonderful resource for older people on increasing their exercise and increasing many other things. They have wonderful videos that people can go to. And again, if you don't have time to copy this link, you can just go to Google National Institute on Aging and Go for Life, and it should pop up. So what type of exercise and how often do we need to exercise? What research is recommending now is that healthy older adults should engage in 150 minutes a week of moderately intense aerobic activity, or 75 minutes of vigorous intensive activity for at least 10 minutes in order to have these health benefits. It is also suggested that there be muscle strengthening exercises done at least twice per week to maintain our muscle strength. These are things that all of us can do regardless of our age. And finally, continuing to be engaged in cognitively stimulating activities, participating in senior centers, participating in senior university programs at the local college or university. These activities should be challenging and fun. They should be engaging with other people so that you get the social part of the activity, and they should encourage people to try something new. Our brain needs to be exercised, and doing cognitively stimulating activities with other people is a very important part of maintaining health. This booklet, which is put out by, again, the National Institute on Aging, is a great booklet on understanding memory loss, and it talks about all of the different things that could be causing memory loss, and how to go about determining whether you should get an evaluation. It's available as a PDF online, and so people can download it to their own computers and read it at their leisure. So now we're going to move into seeking an evaluation. If people are having mild memory problems, the first thing we want to encourage is that they get evaluated as soon as possible. First of all, we want to make sure that if they have a reversible cause of their memory problems, that it gets treated very quickly. If there are low B12, we want to have that treated as quickly as possible. If there are other health problems that could potentially be affecting their memory, like their blood pressure or their diabetes, we want those to be checked and to have them receive the help they need to manage those diseases. And if they are having Alzheimer's disease, there are medications that are available, and they are the most effective in the early stages of the disease. And finally, having a memory evaluation allows people to begin to plan for their own future. Now, there are some people who refuse memory evaluation, and this generally happens when people are further along in their memory loss. They are at the point where they don't recognize that they have a problem. And I think for families particularly who may be calling and wanting information about how to encourage their family to have an evaluation, this lack of recognition of a memory problem is one of the biggest concerns they have. So what we try to do is encourage people to families to normalize that problem, and to say, well, maybe the focus is not on getting their memory evaluated, but their focus is on getting an evaluation of their health to see if there are any problems. Sometimes people think that their problem is so mild that there's no need to worry, and that may be true. Encouraging them to get an evaluation may help to affirm that they, in fact, do not have a memory problem. Many people are not aware that there is treatment for memory problems, and we want them to know that if they are having some mild memory problems, there are things that they can do. We also hear that people are fearful that they will lose the ability to make decisions. And I actually think the opposite is very true. The earlier in their life that people become aware of a memory problem and seek an evaluation, the more ability they have to make decisions before their problem becomes more serious. So what are the components of a memory evaluation? Generally, and we like to normalize this so that people aren't fearful when they walk in for an evaluation. The first thing that a doctor will do is take a history and find out what the person who has come for the evaluation is personally experiencing. They want to hear what they have noticed about themselves. We always encourage people to come with a family member or a close friend who can also give their impression of the onset of the problem and what they have noticed. The second thing that is done is, of course, their medical history is reviewed to see if they have any health problems that might be impacting their cognitive functioning. A neurologic exam is done by the doctor. there are paper and pencil testing of memory and thinking skills. In our clinic, these paper and pencil tests take about an hour, and the outcome of them is people are evaluated based on their age and based on their educational level, and then how they did on the test. I think this is one of the things that people worry about the most. But again, I try to normalize that by saying, when you take tests, part of the goal is to see what you can do, but it's also to push you to the point where you might have some problem. And so I used to talk about it as fun and games, but I had enough people with memory problems who came back to me and said, Susan, that is not fun and games. It's anxiety producing. So again, we want to normalize and prepare people for those tests. We also do blood work to rule out, again, metabolic or physical causes of memory loss. And finally, the doctor will recommend a MRI or order an MRI to look for evidence of strokes or shrinkage or brain tumors or other things that could be impacting their memory problem. One of the big research advances that have taken place and that we've learned about more in the last 15 years is that the results of spinal fluid examination can now help us identify the proteins that are the cause of Alzheimer's disease. And so it has become, this is not something that is done with everybody, but with many people who get mild cognitive impairment and want to know if they're at risk of developing Alzheimer's disease, may definitely get asked for and be given a spinal fluid test, which is when a small amount of your spinal fluid is withdrawn from your back. And our spinal fluid goes up into our brain and bathes our brain. So it's kind of a window into our brain. And through the spinal fluid, they're looking at the proteins that would be are identified as risk factors for Alzheimer's disease. Again, not everybody goes on to have a spinal fluid test, but a certain percentage of people do. When you have an evaluation, again, the doctor is trying to determine, do you have normal age-related memory problems? Do you have mild cognitive impairment? Or do you have dementia? And so I want to cover just briefly what is dementia. First of all, dementia is a progressive decline in cognitive abilities that gradually erodes our intellectual abilities. And it results in both cognitive changes but also functional changes. This is the big difference between dementia and mild cognitive impairment. In mild cognitive impairment, people are not having a functional deterioration. And in dementia, this functional deterioration leads to an impairment in social and occupational functioning. However, dementia does not tell you what is causing the memory problem. It's a general term. It's sort of like a symptom. If you think about a cold, a runny nose is a symptom of a cold. Runny nose doesn't diagnose the cold, but it is certainly a symptom of it. So the dementia symptoms are symptoms, and we want to find out what is the diagnosis. Until you have a diagnosis, you don't know how to treat the dementia. So the early symptoms provide clues for what the diagnosis is. Some people have an early onset of progressive memory loss. Some people have a first symptom of other things like behavior changes, or they have hallucinations, or they might have tremors. Looking at these first symptoms do give the doctors a clue about what the diagnosis is. Some of the causes of dementia that may be reversible are delirium, things that happen suddenly that may be caused by an infection or a hospitalization or even a reaction to a medicine. People are suddenly delirious. Their cognitive abilities change suddenly. And sometimes these sudden changes of cognition are reversible if you find out what the cause is. Other reversible causes of dementia may be B12 deficiency, a thyroid disease, or depression. And we want to examine and have all of these treated. But if we do not find a cause for the dementia symptom, oftentimes the diagnosis are one of these that you can see on the screen in front of you. Alzheimer's disease is definitely the most common cause of dementia. And there is treatment for Alzheimer's disease, so the most important thing is to begin that treatment just as early as possible. This is another chart. On the previous chart, the risk of getting Alzheimer's disease is listed as probably between 50 and 60%. Recently, according to the 2017 report of the Alzheimer's Association that you can, again, get online, Alzheimer's disease is the cause of dementia 60 to 80% of the time, and Lewy body dementia approximately 10%, vascular dementia 20% of the time, and then there's other types, with the most common of those being frontal temporal dementia. So, stages of memory loss are normal age-related memory loss, mild cognitive impairment, mild Alzheimer's disease, middle-stage Alzheimer's disease, late-stage Alzheimer's disease, and terminal stage. It's important to identify people early on. The risk of this is a chart that shows the number of people in Georgia who have Alzheimer's disease. In 2017, there are a total of 140,000 people that have been diagnosed with Alzheimer's disease. And you can see that the risk of Alzheimer's disease is going up. By 2025, in Georgia, it is anticipated that there will be 190,000 people identified with Alzheimer's disease. And what is important is that we identify them so that we can treat them with the medications that have available, provide them with the support services that they need to continue to live a quality life. And I think what's also important is to find a way to impact the disease before symptoms become serious. This is a family who has been identified, one of the people have been identified with mild cognitive impairment. And the importance of that is that they can then be proactive. They can look at their own healthy brain risk factors. They can perhaps change some things. Perhaps they can exercise more. Perhaps they can eat a better diet. And they and their family together can do planning for their future so that they have a plan and they know if they should go on to develop something more serious, how they want their care to be, and who they choose as their decision maker. If it is a mother and daughter, they can talk openly about what the challenges are and how they can help each other with planning for the future so that there aren't any surprises for people. Caregivers are also affected significantly by the dementias. And as I mentioned earlier, even at the mild cognitive impairment stage, people couples are concerned about their marriage because they weren't aware that the memory problem was causing some changes in their relationship. But with Alzheimer's disease, there is a tremendous amount of unpaid care that is done by family and friends, and the health care of caregivers is at risk because of the stress they are under. We know that this cost will also go up as our population ages and as more people become caregivers. Caregivers, as we all know, provide a lot of help for people with Alzheimer's disease by helping them with their instrumental activities of daily living, helping them follow their medication regime, and as the disease progresses, helping with daily activities and managing behavior symptoms. And these are the families that need support in finding day programs and arranging for help in the home. And I think one of the most important things that caregivers do is they provide emotional support and a sense of security for people as the disease progresses. So one other proactive thing that people who have either normal age-related memory problems or mild cognitive impairment or early Alzheimer's disease, one of the things that is proactive that we want to encourage people to do is to look into research. And one of the things that many people are not aware of is that research on cognitive aging requires people who do not have memory problems as well as people that do have memory problems. One of the studies that is encouraging people to enroll is Emory's Healthy Aging Study, which is a study to look for predictive markers that can predict diseases that occur more commonly in later life years to hopefully find a way to predict it earlier on and to take proactive action with those diseases. This is a website that you can go to learn more about it and about the study. Or you can just Google the Emory Healthy Aging Study and it would probably pop up. And this healthy aging study is not just about memory problems. It's also about other health conditions. This is a study that is enrolling people that are 18 years and over. Participation means signing up online, indicating that you understand the terms of involvement, and completing a brief health history questionnaire. You may be asked to share information from your fitness tracker, or if you're an Emory patient, from your medical record. And periodically, you will be invited to complete surveys or assessments, or will be invited to participate in other voluntary research opportunities. A subset of the Healthy Aging Study is the Emory Healthy Brain Aging Study. And you'll find a link from the Healthy Aging Study to this one. And in this study, we're trying to understand aging and age-related diseases. Participants have to complete that health history questionnaire and be a part of the Emory Healthy Aging Study. And then they will be asked some additional questions, and they may be invited in for assessments or scans or even specimen collections. But of course, they would have the opportunity to say no to anything that they did not want to participate in. Finally, the importance of finding a prevention for Alzheimer's disease is what everybody is looking for. And there have been many studies that have not proven, new medicines that have been in testing that have not had positive results. We like to say that even if a study fails to improve, it still has a result. And currently, studies have moved to looking at prevention trials, and we are currently recruiting for four prevention trials. We currently have 7 studies for people with mild cognitive impairment and 4 studies for people with Alzheimer's disease. And an exciting thing is that there is one research study for people who are caregivers. So research is one of those positive things that people can do that may have an impact on them. Although for many people that are enrolled in research, what they say is, I'm looking to help my children or my grandchildren in the future. So I want to say thanks to all the individuals with Alzheimer's disease, with mild cognitive impairment, and their families who've allowed me to be on the journey with them over the years. They are my heroes. And please don't forget to take the post-test.
Well, thank you so much, Susan. It was such a pleasure. It was great to hear about some risk factors and how we can recognize them. As Susan said, remember that the link to the post-test is pasted onto this last slide. Please take it at your earliest convenience. A certificate can be provided by entering your email address at the end of the post-test. Please remember to view the other webinars in the Dementia Capable webinar series provided by the Rosalind Carter Institute for Caregiving in partnership with the Georgia Division on Aging Services. Thank you, and we hope that you'll join us again.